we had to work full time and then also had to be a teacher, parents, a chef at the same time.
Meniyaz Aziz's family in Canberra's north has a newfound appreciation for getting outdoors after spending more than a fortnight quarantining at home.
It put on a lot of pressure on us.
The family's 2 children attend the primary campus of a school that caters for preschoolers through to Year 10 students. A senior student tested positive to COVID, yet every student in all year groups, more than 1,000 kids in total, were told to self-isolate along with every member of their household.
Yes, in my eyes, it was the right decision. My parents in Bangladesh did have COVID last year, and I know the first hand that how bad it can be.
With cases at several schools, there were about 20,000 Canberrans in quarantine at one point. That's around 1 in every 20 residents.
And that impacted on frontline health workers, it impacted on policing, it impacted on our emergency services agency and on government's ability to deliver our pandemic response.
Widespread isolation orders like those seen in the Territory could soon be a thing of the past. Coronavirus cases are expected to soar in the ACT, New South Wales and Victoria as they reopen, but amongst well-vaccinated populations. So, who will need to isolate or get tested?
With the Delta variant, the definition of close contact has really broadened. I think it is right that we will now have to bring that definition back into some narrower space that may then relate to the vaccination status of the case themselves.
We don't need to put everyone in isolation, but identifying the key individuals who are most at risk.
England learned the hard way that telling too many people to isolate can cause its own problems. When the country reopened in July, more than 2 million people received smartphone alerts from the UK's health service. The message said they were close contacts and needed to isolate for up to 10 days, even if they were fully vaccinated or got tested and returned a negative result. The notification pings became so common, the period became known as the pingdemic.
Level of frustration grew very quickly with the app.
It came at the wrong time of year for businessman Mark Cribb, adding to summer staff shortages at his restaurants and bars in the beachside town of Bournemouth.
For 12 years, we're always, in the summer, we're open every single hour we can, from 8 a.m. till midnight, 7 days a week. We haven't been able to do that this year. We've had to close 3 nights of the week, which has been heartbreaking.
Mark says around 5 staff members would be pinged each day and told to stay home.
There was one day where we had to phone 150 people who had reservations for dinner that evening and cancel their bookings.
Hello, gentlemen.
Many Brits came to regard the alerts as pointless and deleted the app. The UK government was forced to change its advice so that fully vaccinated people were told to get tested but didn't need to isolate.
That's the difficulty with contact tracing. It does rely on that partnership with the community. And if they think the health department's got it right, then they'll work with them.
Australian states and territories know they need to avoid a pingdemic situation here as they look at automating parts of the contact tracing process.
For our contact tracers, it's going to mean focusing on the highest risk people.
The ACT's Health Minister, Rachel Stephen-Smith, says one of the ways to assess that risk could be questionnaires automatically sent to those who test positive and their contacts.
The first step when someone tests positive might be that they get a questionnaire that identifies whether a human being actually really needs to talk through the risks associated with that case. And then there's a questionnaire that might go to an identified close contact, which again works through how much of a close contact they were, whether they need to go into quarantine. And again, that might be something like, are you vaccinated or are you not vaccinated?
Using technology to help with contact tracing isn't an entirely new concept in Australia, although it hasn't always produced the results that were hoped for. 7:30 can reveal that during current outbreaks, New South Wales and the ACT haven't accessed any data from the Commonwealth Government's COVID Safe app, while in Victoria, COVID Safe has failed to find any contacts that weren't otherwise known to authorities. Since the start of the pandemic, COVID Safe has only identified 17 close contacts that weren't found by state officials. States have instead relied on their own QR code technology, with the ACT and New South Wales moving towards exposure site notifications within their check-in apps.
So once you log in, you'll be notified that we've changed the settings.
Victor Dominello is the New South Wales Minister who's responsible for the state's check-in application, Service New South Wales. Today he's giving 7:30 the first look at a soon-to-be-released function telling users if they've been to a venue of concern.
And then in the next screen, you can go there and it will indicate what you need to do. Well, this will be your starting point, but then obviously there'll be further escalations if health deem it necessary, such as a text message and then a phone call directly if you're an immediate contact.
He's keen to avoid a pingdemic situation, so much so that he wants checking in to become voluntary in settings that aren't high risk as soon as double-dose vaccine rates get high enough.
I think the QR codes should be retired once we get to the 90% mark, subject to health advice, because this goes to trust. Hypothetically, if there is another variant next year, when we ask the public, hey, we've got to go back, they'll trust us to do it.
It will be a fine balance as authorities work to keep the public on board in the ongoing and ever-changing fight against COVID.
And what they've got to find is they've got to find that sweet spot where people still buy into it, where the economy can try and get back on its feet, but it does also have an impact on COVID numbers.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.